As a lawyer, we talked about all this. It's confusing to even some physicians to understand. What's the best thing you can kind of leave us with what you advise someone who's seeking a surgery to do? We talked about looking up some of these websites to see if they're listed, these memberships to see if they're listed. Now the main problem now comes with false advertising. There's very few people that have the huevos to actually go and say, I'm a board certified plastic surgeon. Usually they say, world-renowned celebrity cosmetic surgeon, or this or that.
And you know what, yeah, and one of the things, so false advertising is not only actionable in a civil lawsuit, aside from negligence and all the other claims that can be brought, but it is definitely actionable by the medical board against the doctor in order to either suspend or revoke, probably revoke, the doctor's license. You are not to falsely make yourself out to be something that you're not. And in this particular area, it's often done by doctors who will call themselves cosmetic surgeons. When the patient comes in and has the consultation, they may not say, oh, I'm board certified. Like you said, they may not have the, you know, the guts to do that, but they will allude to the fact that they have certain, you know, they've done certain number of surgeries, rhinoplasties, they've done certain number of breast augmentations, that they are performing these at licensed hospitals, that they are the pro, they are skilled. So even though they're not blatantly using the word, I'm a certified plastic surgeon, they are holding themselves out to be something that they're not. They haven't really done that many surgeries. They don't really do them in those hospitals. And so the board takes that very, very seriously, and that is grounds for revocation of a doctor's license. And certainly if you're criminally prosecuted, like the gynecologist in Placerville, that's the best way for the board to take away your license. Following a felony conviction as a result of a criminal prosecution, the board has a much easier time instituting a disciplinary action and taking away your license, in addition to whatever else that they might be able to claim that may not be a crime per se, but it's still an ethical violation or, you know, something that's subject to discipline. So.
You know, the whole gray area right now is with Instagram, social media, Snapchat. I love Snapchat because I can actually show people, look, I'm in surgery, look at how clean I work, look at my work, it's meticulous, and I show it in real time with timestamps. But, you know, fillers, Botox, lasers, it's a gray area.
HIPAA with the patients.
No, I always get permission, yeah. Right. We have a permission form this big. So the thing is, as far as the fillers, Botox, lasers go, I'll be very honest, you know, if you ask most plastic surgeons, by now so much time has passed that we're doing this, we don't care that much that other types of physicians are doing this, even if your family practitioner wants to do this. We do have a problem though when they start to say they're a cosmetic surgeon or they're a plastic surgeon, etc., when they're doing some of this stuff, because trust me, who do they call?
And well, the other one's invasive.
Yeah, but here's the thing, guess who they call when they inject a lip and they inject the artery and half the lip becomes dead or necrotic or the skin falls off? Guess who they call? They call their friendly plastic surgeon in town. What do we do? So even with those minor procedures, a lot of times you're better off going somewhere where the medical director is a board certified plastic surgeon, where you know you're protected, that if something goes wrong, you don't have to leave that office to get taken care of and be referred urgently somewhere else.
Right.
And plastic surgeons have to have privileges at hospitals. I have privileges at UCLA Medical Center because I teach the residents at UCLA and I'm an assistant clinical professor there. But it doesn't have to necessarily be a university big hospital, but even a small minor community hospital, they will not give privileges for someone to perform those plastic surgery procedures, even Botox, in their operating room, unless you're board certified and you've passed certain exams and you have board certification in plastic surgery. So I think it's a very thorough discussion. We're going to give you Sara Azari's contact information, Twitter handle, Instagram, my social media as well, and the few websites that you can go research. We hope this is really valuable to you. Remember, the first thing you have to do is check that they're on these websites, that they're board certified, legitimate plastic surgeons. Beyond that, if you're getting actual surgery, not just fillers, Botox, but surgery like fat transfer to your buttock, breast, these are big surgeries. Just because it can go into a syringe doesn't mean it's minor. If you don't know the anatomy of the buttock and you inject fat in the wrong place and it goes into a vein and travels to your lungs or heart, you could die. So someone
That
who's
was
doing
the
this,
recent case that came up a week or so ago. Yeah, I think that the best prevention is do your research, do your investigation, only go to somebody who is board certified, who's a board certified
basis.
plastic surgeon. Yeah, and then from there you can then choose who's going to do the best job for you. And you know, that's my message to the consumers and to the patients that would come to your office. And my message to the doctors who might be watching this is stick to your area of expertise, because you can get into big trouble and end up in my office. So
you don't want that. So thank you.
Thank you for
Sarah,
having me.
Always
Thank
a pleasure.